Health authorities have not been able to positively determine whether the two residents from regions 1 and 4 were actually reinfected. However, what is certain is that more than 90 days after recovering from the initial infections, the duo began exhibiting symptoms again. Dr. Mahindra Karpan, head of internal medicine at the Georgetown Public Hospital, during a telephone interview with Nightly News on Tuesday, confirmed that the two patients presented with mild symptoms of the disease some 3 months after they were initially infected.
It was a suspicion, and based on the symptoms that these persons had, that is the logical conclusion that we came to. It could have been something else, but in the COVID era, we tend to ascribe everything to the COVID.
He, however, noted that because the symptoms were mild, the patients were placed in home isolation and were not retested.
We were able to manage their symptoms, which were mild the second time, at home without progressing to hospital visit or hospital admission.
Divulging a bit about the clinical history of the two persons, Karpan said one of the patients started showcasing symptoms of reinfection a few months after Guyana's imported index case on March 11, while the other was detected approximately 3 months ago. Both patients have since recovered. The Ministry of Health on July 17 introduced a new criteria for the release of asymptomatic COVID-19 patients, which was recommended by PAHO WHO. The guidelines necessitate a minimum of 10 days of home isolation for patients who do not exhibit any symptoms during the onset of infection. If the patient remains symptom-free throughout the 10 days, they are advised to stay in isolation for an additional 3 days before being medically cleared of the disease. This new mechanism eliminates the need for patients to undergo a second test to clear them of COVID-19. According to information presented by the Centers for Disease Control and Prevention, people appear to become susceptible to reinfection around 90 days after the onset of infection. A new United Kingdom study in November suggested that individuals who have previously had COVID-19 are highly unlikely to contract the illness again for at least 6 months following their first infection. The Pan American Health Organization World Health Organization in October of this year indicated that because confirmation of SARS-CoV-2 reinfection requires relatively complex laboratory support, an operational case confirmation and surveillance system are necessary to detect suspected cases of reinfection. Belgium, the Netherlands, the United States, and several other countries around the world have registered COVID-19 reinfections. Temika Rodney reporting for the HGP Nightly News.